Mr Andrew Selous.
Thank you very much, Mr Speaker. This adjournment debate provides an opportunity to discuss a very important but often overlooked issue which can have a major impact on the well-being of older people, namely their oral health. Many of us will have older relatives who've reached the stage where they need some extra support. It might be that they live in a residential care home, have a carer who visits them in their home a couple of times a week, or just require a bit of extra help from us personally to stay independent. However, one issue that often slips under the radar when we think about an older relative's needs is their oral health. It can often seem like a small issue, but in fact, poor oral health can have much wider implications. Having a painful oral health problem can impact on someone's ability to eat comfortably, to speak and socialise with confidence, and on the ease with which they can take medication, something which may be a particular issue if an older person is living with other long-term health conditions. Maintaining good oral health can also become much more challenging for older people with reduced dexterity, who may, for example, have more difficulty with brushing their teeth. Furthermore, for the most vulnerable older people, such as those with dementia, who may have difficulty communicating where they are experiencing pain, an oral health problem can be especially distressing. Ensuring that older people are supported to maintain good oral health and have access to dental services when they need them is therefore very important. However, while data on this issue is limited, the information that we do have suggests that these are areas in which we often fall short. The Faculty of Dental Surgery at the Royal College of Surgeons published a report on improving older people's oral health in 2017, which estimated that 1.8 million people aged 65 and over in England, Wales and Northern Ireland could have an urgent dental condition such as dental pain, oral sepsis or extensive untreated decay. Moreover, the Faculty of Dental Surgery also highlighted that this number could increase to 2.7 million by 2040 as a result of several demographic factors, thereby increasing pressure on dental services in the future. As well as the ageing nature of Britain's population, increasing numbers of people are also retaining their natural teeth into old age. While this is good news, it also means that dental professionals are facing new challenges as they have to provide increasingly complex treatment to teeth that may already have been heavily restored. Separately, in 2014, Public Health England published the findings of research looking at oral health services for dependent older people in North West England, which found that access to domiciliary and emergency dental care can often be very challenging for those living in residential care homes or receiving care in your home support services. More recently, Public Health England last year published the results of a national oral health survey of dependent older people living in supported housing. This revealed that nearly 70% of respondents had visible plaque and 61% had visible tartar, indicators of poor oral hygiene, and that in some parts of the country, such as County Durham and Ealing, over a quarter of dependent older people would be unable to visit a dentist and so required domiciliary care in their home. It's difficult to get a complete up-to-date picture of the oral health needs of older people across the country, partly because there's not been an adult dental health survey for 10 years, which is an issue I will return to later. However, these figures, as well as anecdotal reports from dental professionals working on the front line, suggest there's a real issue here which potentially impacts on large numbers of often vulnerable older people. Of course they will.
Thank you for giving way and for bringing a very important issue to the House. And as you've rightly said, 1.8 million elderly people across the whole of the United Kingdom of Great Britain and Northern Ireland have problems. And indeed it is shocking when you consider that. The Honourable Gentleman has outlined some of the solutions to perhaps what he's put forward, and that is extra attention in domiciliary homes, extra attention in residential homes, extra attention when it comes to people who are at home and depend upon carers. But is it also the case that when it comes to older people, that their confidence can also be diminished by not having their teeth correctly done. My mother went this week to have her teeth done, and I can tell you quite clearly, her dentist, my mother's 87 years of age, by the way, and she depends very much upon her dentist as a tenant over the years, and those who haven't, and there are many, we need to have that care at all those different levels.
Very grateful for the honourable gentleman giving his personal family experience on this issue. Now, there have been some welcome developments over the last few months, including the recently published NHS long-term plan, which highlighted oral health as one of the priorities for NHS England as it rolls out a new enhanced health in care homes programme across the country. However, I would like to draw the Minister's attention to 5 particular areas in which more could usefully be done: training for health and social care professionals, access to dental services, data, regulation and the Social Care Green Paper. First, training. Health and social care professionals regularly do a brilliant job of caring for older people. But as I've already mentioned, oral health is one issue that can very easily fall between the cracks, particularly if someone is living with a range of other health conditions which also require care and attention. One example of this is oral care plans. Ideally, when someone is admitted as a resident to a care home, their oral health needs could be considered as part of their initial health assessment. These should often then be reflected in an oral care plan, which all their carers are aware of, and which will set out, for instance, if the resident needs some extra help brushing their teeth. There is some very good guidance from the National Institute for Health and Clinical Excellence, but despite this, it can often be overlooked. In Public Health England's research in North West England, which I referred to earlier, 57% of residential care home managers said they did not have an oral care policy, and 1 in 10 said an oral health assessment was not undertaken at the start of care provision. Knowing how to provide good oral care is especially important when it comes to supporting those with more complex needs. For example, for those with dementia, electric toothbrushes can sometimes be quite intimidating, and it makes a big difference if a carer knows they should use a manual toothbrush when helping with toothbrushing. More broadly, if someone who's living with dementia refuses oral care, this can become an obstacle to maintaining good oral health, so it's important that carers understand how to manage these situations, ideally with input from a dental care professional. Equally, for those with dentures, it's important that training and procedures are in place to minimise the risk that a denture gets lost, even if this is a simple thing like ensuring they're kept in a jar by the bedside when not in use. A lost denture takes weeks to replace, so this can be a devastating experience for an older person who relies on them to speak and eat. This is particularly sensitive if someone is coming to the end of their life, when it may not be possible to manufacture a replacement in time for their remaining days with loved ones. So an understanding of good denture care is particularly important in these situations. Improving the awareness of oral health amongst health and care professionals should therefore be a priority, and was a key recommendation from the Faculty of Dental Surgery's 2017 report. This highlighted schemes such as Mouth Care Matters programme, in which mouth care leads are recruited to provide oral care training to staff in hospitals and care homes, and I'd be interested to know from the Minister if there were any plans to replicate such initiatives nationwide. Secondly, ensuring that older people can access dental services when they need them is also essential. It's not uncommon for people to think that if someone has no teeth, they cannot be experiencing pain or other oral problems. Sadly, this is not the case, and they should still have an oral checkup once a year, not least because the majority of cases of oral cancer occur in people over 50. There are all too many tragic instances of an older person being diagnosed with oral cancer too late, the saddest words in the English language, simply because they had not seen a dentist for a number of years. Attending a dental appointment can be a particular challenge for those with reduced mobility if they're unable to climb stairs to reach a dental practice on the first floor, in which case domiciliary visits are vital. However, as I discussed earlier, evidence suggests that access to domiciliary dental care can be challenging, particularly for those living in care homes or supported housing, and I'd appreciate the Minister's thoughts on how we can address this. In 2015, Healthwatch Bolton reported that it was easier to get access to a hairdresser than a dentist if you were a local care home resident. In 2016, Healthwatch Kent reported that care homes had told them about accessibility problems for wheelchair users within dental practices. In 2016, Healthwatch Lancashire reported that care home staff had said the residents don't get regular checks, they're only seen when there is a problem. And in Healthwatch Derby, there was concern about the lack of information for social care providers about how to access dental services for their residents. While the commitment in the NHS long-term plan to ensure that individuals are supported to have good oral health in care homes under the Advanced Health in Care Homes section is very welcome, there is no mention of a similar commitment for those older people who use domiciliary care agencies. These people should not be forgotten, and I'd like to know what the government intends to do about this issue for domiciliary care agency users under the NHS long-term plan. Third, the intelligence around older people's oral health is quite limited, and this makes it difficult to build a full picture of the level of need as well as the barriers that older people face to accessing dental care. The most immediate action could be taken to address this is for the government to commission a new adult dental health survey. This is one of the few resources to provide detailed national-level data on standards of oral health amongst older people and is a key reference for many commissioners, policymakers and dental professionals. The adult dental health survey has been conducted every decade since 1968, with the last edition being published in 2009, meaning a new edition is now due. However, the government have yet to give an indication of when or indeed if a new survey will be taking place, something that I know is causing concern with the dental profession, so an update on this evening would be most welcome. In addition, there are other steps that could help improve our understanding of these issues. For example, NHS Digital publishes a regular set of NHS dental statistics for England. These report on the proportion of children aged 0 to 17 who attended an NHS dentist in the preceding 12 months, as well as the proportion of adults aged 18 and over who attended an NHS dentist in the last 2 years. This provides a useful measure of access, and expanding these figures to provide attendance rates for older people would help us develop a clearer picture of whether there are particular groups or areas where access to an NHS dentist is a problem. I will very briefly, if you won't mind.
Deputy Speaker, the thing that just came to mind as the Honourable Gentleman was speaking there was the issue of many elderly people are independent and possibly proud as well. And one of the things that puts them off, I'm aware of in my constituency, is if they think that they have to go to the dentist and pay for their treatment. They don't have to pay for the treatment. Maybe that's a reminder needs to be put out as well.
Well, I'm grateful to the Honourable Member for putting that issue on the record. Fourth, regulation. In addition to health services, care home providers and dental professionals, regulators can play an essential role by monitoring standards of oral care and driving improvements. The Care Quality Commission in England does not explicitly look at oral health during its inspections of hospitals and care homes, although I understand it is doing quite a lot of work behind the scenes to try and push this onto the agenda for care providers, which is obviously very welcome. Health and care regulators in other parts of the UK can also make a valuable contribution to ensuring the importance of oral health is recognised by those they inspect. Lastly, I continue to look forward to the publication of the Government's long-awaited Social Care Green Paper. Given the importance of oral health to our wider health and well-being, an all-encompassing model of care for older people must include dental services, so it will be important that when published, the Green Paper clearly sets out how social care and dental services can work together in future and what more can be done to ensure older people have access to dental services when they need them. As I've mentioned, one of the most valuable things we can do to improve older people's oral health is to simply ensure that it's not overlooked amidst the many other issues we're dealing with, and I hope the Government will show leadership on this in the Green Paper. Oral health can sometimes seem like a small issue, but it has very significant impact on the quality of life. The Minister will be aware that we've spoken a lot in recent years about the need to improve children's oral health, and quite rightly so, but it's also essential we don't take our eye off those other groups who need support in this regard. For an older person who's in pain because of an oral health problem, finding it difficult to eat or speak, or who may be distressed at the loss of a denture that will take weeks to replace, these issues are very real. We can all contribute to addressing this, including members of this House who care for older relatives in our everyday lives. Indeed, the Faculty of Dental Surgery published some useful advice over Christmas about using visits to older relatives as an opportunity to check their oral health and how to spot the signs that they might have an oral health problem, and perhaps when members visit elderly relatives over Easter, Mr Deputy Speaker, this is something we could all do and encourage our constituents to do as well. However, I hope the Minister will recognise that government too has an important role to play and look carefully at what can be done to help improve oral care for our older people.
Right. Thank you very much, Mr Deputy Speaker. I realise that a debate on older people's dental health is just merely a passing interest for you. You are many years from it being of direct interest. But I hope you enjoy the response. And I congratulate my good friend, solid, sir, my good friend from South West Bedfordshire for securing time and for the way he set out his case so very clearly. I'll do my best to answer his points in the time that I've got, and anything I don't, he knows that I will write to him. I think it's first worth saying, Mr Deputy Speaker, that oral health has improved significantly over the last 40 years that I have been alive. At the start of the NHS, it's worth noting this incredible statistic, 40% of the population had no natural teeth. And that figure is now, answers on a postcard, 6%. So, these are massive improvements, aren't they, which I think are to be celebrated. But of course, with improvements come new challenges. As we're all aware, older people, for whom we categorise over 65 for the purposes of this conversation, make up an increasingly large proportion of the population. By 2032, we project there to be 13.5 million people aged 65 and over in our country. Older people are retaining far more teeth than ever before, often heavily filled than previous generations. So, of course, as people age, so do their fillings and all the other bits of their bodies, and ongoing restorative work is needed. Now, many older people live independently and are in full charge of their oral health as working age adults. But we recognise that frail older people, Mr Deputy Speaker, those with additional needs, often living in care homes or supported to remain at home, as my honourable friend set out, can face real barriers to accessing the appropriate care and support that they need to maintain good oral and dental health. And that good health is an essential part of active ageing, and my honourable friend set out some of the reasons why. We know that poor oral health can affect an individual's ability to eat, which then obviously can lead to an acute episode and an encounter in the tertiary sector, to even to speak, to socialise, and obviously it hits their confidence, and then it spirals. And I think for older adults who are frail, good oral health is particularly important to maintain hydration and the ability to eat comfortably and easily, helping them to sort of stay healthy and stay independent for as long as possible, and even to stay well when they are in the care home setting. So, as we set out, Mr Deputy Speaker, in our 2017 manifesto, we are committed to improving the nation's oral health from children right the way through until to older people. The NHS long-term plan published last month set out our plans specifically to ensuring that individuals in care homes are supported to have good oral health, and it's a point that the honourable gentleman, my honourable friend, raised. So the long-term plan national implementation framework, due to be published later this spring, and the national implementation plan, due to be published this autumn, will provide further information on how the LTP will be implemented. But I want to turn now to the 5 specific issues raised by my honourable friend.
Would my honourable friend allow me, just very briefly? There was obviously concern raised by the Royal College of Surgeons about people using domiciliary care agencies. And while there's still time, would it be possible for the NHS long-term plan to address that issue as well, so we look after all older people, not just those who are in care homes, every type of care they get?
Yes, I will touch on that, Mr Deputy Speaker, but I take his point, and I will make sure that it is flagged up in writing as a note from me, the Minister, to the relevant officials as a response to this debate. So start with the NICE guidance. So in 2016, the National Institute published their Oral Health in Care Homes report, and it was an important piece of work. As we know, it sets out a number of recommendations for care homes to help maintain and improve oral health and ensure timely access to dental treatment for their residents. In dental health, as in every other bit of health, prevention, Mr Deputy Speaker, is better than cure. Now, I completely agree that we would expect care homes to be following NICE guidance and NICE recommendations in this area like every other, alongside the importance of appropriately trained staff, which my honourable friend makes important points on the role regulators can play in this area. So the Care Quality Commission, they are obviously responsible here, as they are for many other areas of policy. They're currently looking in depth at oral health for older people in the residential care settings, and much needed that is too. So last autumn, CQC's dental inspection teams joined adult social care inspectors on visits of around 100 care homes to gain a better understanding of the oral health care support for those residents. Now, I know that CQC intend to publish the findings later this year. I've been asked to be kept very closely updated on the progress of this work and to have early sight of its findings, and I will update the House and my honourable friend in particular, knowing his interest, and of course he's a member of the Select Committee, so I will make sure the members of the Select Committee are aware of it as well. I think we should also recognise, Mr Deputy Speaker, and highlight the ongoing work of NHS England and Public Health England, whom I sponsor within my portfolio, to improve the oral health of vulnerable older people. So NHS England, as referred to in the long-term plan, considers oral health for older people, particularly those in care homes who may be vulnerable, a particularly important issue. Now, I've asked also to be kept up to date on progress as they take forward action on this and other areas highlighted in the plan. Public Health England has published Commissioning Better Oral Health for Vulnerable Older People, snappy title, which is designed to support commissioners of services to improve the oral health of vulnerable older adults so they can lead a healthy, long and meaningful life outside of the acute sector. And my honourable friend highlighted the Mouth Care Matters programme, which, as he says, is a local training initiative from Health Education England, offers support and training in oral healthcare for the elderly, for hospital staff, looking after patients who may need help with mouth care as well. Now, I know the programme has been very successful locally in Kent and Surrey and Sussex. Now, decisions on whether to extend the training wider are for Health Education England, but I would hope that the success of the programme to date means that HEE are able to take it forward to new areas in the longer term, including my honourable friend's county. I can't give the nationwide answer that my honourable friend asked for in his speech, but I would suggest that the early signs are positive. Let me touch on access to dental services, Mr Deputy Speaker. So, in terms of access to services currently, NHS England are legally responsible for commissioning those services to meet local identified need, and this includes the commissioning of domiciliary care services where that is appropriate. However, it's important to say that where residents can, the care home and the local NHS work together very often very successfully to ensure that dental services are provided in the most appropriate setting for those residents, whether that's within the care home itself, in a dental practice, or provided by the community dental service. And often people who are within care home settings will actually enjoy the trip out to the dentist. It's part of their socialisation, part of their routine, and I don't think we should overlook that. Now, I note my honourable friend's concerns about the availability of oral health data in his speech, particularly for the older age groups. So the Adult Dental Health Survey is a very important tool, I agree, for understanding oral health changes over time. I can reassure my honourable friend that while there is not yet a date set for the next survey, no decisions has been taken to discontinue this important source of information. And I take this debate as a bit of a nudge, actually, to ask more questions about this. And I think if my honourable friend looks at my track record around CPES, for instance, the Cancer Patient Experience Survey, which I was very clear was an important tool to give me information about the cancer patient's experience, I think he will see that I place value in such patient health surveys. In the shorter term, I agree that the regularly published NHS dental statistics on numbers of people seeing an NHS dentist could potentially provide more helpful information by analysis of the data by age. So I'm going to ask my officials to work with NHS England and NHS Digital to pursue this further, and I will assure that he's kept informed on that point. He also raised point 4 or point 5 in his remarks about the Social Care Green Paper. This remains very much a priority, Mr Deputy Speaker. It is not yet in reach, but the Green Paper will cover a range of issues that are common to all adults with care and support needs. and will bring forward proposals to ensure that we have a social care system where people know that the care they receive will help them to maintain their independence and well-being, and is a social care system that we can be proud of. We will shortly be publishing this document, which sets out proposals to reform the adult care system, and I take the points that my honourable friend has made around dental and oral health and how important that is within it, and I will make sure that a copy of his remarks are sent to the Minister of State for Social Care, my right honourable friend, the member for Gosport. I want to touch in my remaining minutes on the Prevention Green Paper, Mr Deputy Speaker. So we set out our prevention strategy last year. It is one of the 3 priorities of the Secretary of State. We are in the process now of developing a Prevention Green Paper, and it's a very exciting piece of work to be involved in. It'll be called Prevention is Better Than Cure. And it'll do exactly what it says on the tin. And I will be engaging with key dental stakeholders, including the British Dental Association, Mr Deputy Speaker, no need to tweet me, in the coming weeks. I look forward to those engagements. In conclusion, Mr Deputy Speaker, disappointed as I am to not have heard from the member for Strangford during my remarks, but I know he has already intervened. I am pleased that we have had the opportunity to discuss these issues this evening in this adjournment debate. I think it's the first time that I have had an adjournment debate on this subject, and I've had quite a few. I hope that we have been able to demonstrate the government's commitments to improving oral health. Of course, there is more to do. That commitment absolutely includes the oral health of older people in care homes, as set out in a long-term plan, and in domiciliary care settings, and our plans to engage with key dental stakeholders in the coming weeks in developing the Prevention Green Paper are honest and sincerely meant. I'll also continue to watch the work of the CQC and the outputs of their report with interest, and I will follow up on the dental survey so that we've got that key data that we need in order to improve services for the people that we're here for, which is our constituents. Thank you very much, Mr Deputy Speaker.
The question is, this House do not adjourn. As many